We also have with us today Dr. Tiffany Anderson. She is the superintendent of the Jennings School District. You can give that a hand. Because just a little over 3 years ago, we may not have thought we would have still had a Jennings School District. But she has come in and through some very innovative work, taken the school from unaccreditation to exceeding accreditation standards. And she's done some wonderful, innovative work, and we have asked her to share some of that today.
Well, it is so wonderful, kind of, one, being in a place of worship, and so let me start off with just sharing a few things that we do, but I must first say I thank God for being here and being next to all of these wonderful people today, and just having a listening ear about what we really deal with. So often we are invisible in what we say and what we have to offer, but I think this moment truly tells you that you are not invisible in her presence. Clearly. And you all know I'm a preacher's daughter, but I'm going to be very short with what I have to say because we've got a lot of people on the panel. Anyone that has driven down Jennings Station Road at 6 in the morning or at 3 o'clock, you normally see me on crossing guard duty, because to do this work and to make the changes that you have to make, you have to be willing to be in schools. You have to remember that schools are now the center of the community. We want it to be church, and we all should be a church, but not every parent sends their child to church. But guess what? They have to send their child to school. And so when you remember that, then you realize you have to do all of these pieces. So I'm going to give some practical examples. I will say, because every teacher loves to show off their children, if any of my students, because I gave them permission to leave early, we do year-round school just about in Jennings. We're one of the only places that does that in the way that we do it. So if any of my students are in the audience, because they may not have made it in, but if any of my students are in the audience, stand really quickly so I can see you. They probably did not make it in, since I told them they couldn't leave till 2:30. Okay. They didn't make it. All right, they're probably standing outside. But with that in mind, Jennings, first of all, I want you to know we're 100% free lunch. We're 98% African American. 3 years ago, we were at, you have to be at 70% to be accredited. Below 50 is unaccredited. They were right around 56, 57 in terms of meeting standards. We are now at 78% as of last year. Was last year. So I thank you. Now let me share with you some things about how we got there. The first thing that you have to know, in order to serve any child, you have to serve the whole child. And so when I say the whole child, let me tell you some things that Jennings does. And it is important for you to know this, because we have got to be the highest minority, almost highest poverty in the area. And so with that in mind, we have one of the smallest budgets in all the districts surrounding us. We have the lowest expenditure as well from all the districts, because resources or low standards or high standards should be high, resources will always be low. But my hope is in what I share with you, it's replicable. And so in Jennings, the first thing that I want you to know in terms of health care, just like you have an eye exam and an ear exam, you really should have as well a mental health screening when you come through the door. And so every one of our schools has a mental health therapist. That's the first piece. Every school has a mental health therapist. It's just part of what we do. We do it for our students. We do it for our families. We're now, through WashU, in a partnership with WashU, building the first kind of hospital clinic. I committed some spaces for classrooms. You can take those classrooms that are on the end of that building and turn it into a hospital. We're helping pay for the construction. It opened in January. The rest of construction is finished. That means we have a pediatrician on staff. Not only will they serve Jennings students, but they'll serve anybody in Jennings, because it doesn't matter if you come to Jennings. Your child is my child. We are all interconnected in this thing, okay? Preschool. In this state, preschool funding is pretty much non-existent, so most of the districts around us do not have preschool. In Jennings, we have preschool. It costs about $60,000 to $80,000, so that means I increase class size. I have one assistant superintendent. There's almost no central office, which is why I wear the tennis shoes and do the crossing guard duty. But by doing that, the money that I save by not having assistant superintendents and all of these other, one assistant superintendent, the money I save, I'm able to have a preschool in every school. You must do that. You must do that. My hope is that that it will start being funded, because Jennings, the progress that we made, we're being innovative, but it's on a shoestring budget. You shouldn't have to have almost no central office and large class sizes and superintendents doing crossing guard duty. I love doing it, but that shouldn't be the norm. And so that is the other piece that we do. And I'll give you two other quick examples, because I truly believe relationships, pedagogy, curriculum is what changes a district. And so in all of our schools, we have a washer and dryer. Parents can wash one load of laundry for free in exchange for 1 hour of volunteerism. Come to any PTO in Jennings, at elementary and middle, and you'll see a packed PTO. You know why you'll see a packed PTO? Not just for the washer and dryers, because we have the only school-based food pantries. We are the only one. There's one that just opened up in East St. Louis. And so we give out 8,000 pounds of food a month. That's 200 to 400 parents a month in Jennings being fed by Jennings. 30% of our staff are employees, and I'm just kind of going off the list because I know we have a lot of folks here. But 30% of our staff that are our employees, we hired our parents and our alumni. Economic recycling. So when you say I have to help the whole child, unless you are fed and healthy and have all of those other pieces, you're not going to achieve. So if you want to know how we're doing it, I've given you a few examples, just a few, but all of you are invited to come to Jennings at any time and volunteer while you're there. Because you heard what she said, it takes all of us. And then the last thing, parents as teachers. So in Jennings, we actually track our children from birth all the way to cradle. And let me share what that means. And we went and just visited, I don't care if you're private, charter, we visited every school that you can possibly imagine that's the top of the state. So we went to New York, Jeffrey Kennedy's, Harlem Children's Home. We came back. And so we have, unfortunately, they don't fund parents as teachers in the way that they need to. So our funding was cut to 1 parent as teacher. So now I'm a certified parent as teacher. I'm going through my training, actually, in a couple weeks. And then we have another staff member that's certified parent as teacher. So when you're pregnant, you meet with us, and then you have your parent as teachers training. When you have your child, you come into one of our preschools. Now in Jennings, we teach 2 grade levels above, so you get introduced to your kindergarten curriculum in preschool. And then when you finish, now, this is not front page news. We have 100% placement. Every one of my 138 babies that graduated, they're either placed in post-secondary or a job, and I have a counselor that follows them all the way through college. That's what it takes to make a difference.
Secretary Clinton, may I suggest Dr. Tiffany Anderson for Vice President?
Well, what I was going to say is I think we've got 3 Oprahs up here. But I'm so glad she talked about the whole child and working with the whole family and providing opportunities for parents to be involved so that they are partners with teachers. And I think what you've just said and the results you're getting should be a wake-up call about what's needed. And I would hope that you would get more financial support for your pre-K, more financial support to do the work that is making a difference in these children's lives, because you've earned it. And you've shown what it means to really take care of our kids.
I want you to know, I lift Dr. Anderson and thought she would be perfect for this because of the work that she's done. We have many, many teachers in St. Louis who are just as committed and as dedicated, and that story doesn't really get told. One of the things that really strikes me about Dr. Anderson is when I called her about this panel, she was on the road. You don't mind me telling, do you? And she don't remember. She doesn't live here. She lives in Kansas, right? And drives to take care of these babies. So when I called at 6 in the morning, she said, "Child, I've been on the road since 2 o'clock. That's the kind of dedication that we have here. Tying this all together, I just want you to be aware that as a part of the Ferguson Commission, we get quite a lot of data. And one of the things that has kept me up at night is the data that says in 2014, there were 1,100 black children sent from schools to the juvenile system. In that same year, there were only 63 white children who had that same result. I again say that this is a race issue, even though we don't want to talk about it. It brings me to the next question.
Reverend Tracy, can I add a piece to what you just said when it comes to education in terms of that?
Yes.
Because that whole piece of the school to prison pipeline, which we all know, and we'll just call it what it is, really things like there was a big report in the Post-Dispatch about suspensions. I mean, just in large numbers, and I probably couldn't quote the statistics properly, but the rate in which African American students are suspended and put out of school as early as kindergarten, literally, I mean, some districts that were suspending for preschool. And then some of the rationales that were in there were things like, I can't afford other alternatives and other things like that. And it does become a mindset piece, because personally, that is not a belief that I have, that you ever put anybody out of education. It's the only thing you're supposed not to be able to take away from you. So you should not be doing that, period. But that becomes a mindset. You adjust the adult behavior. So this cycle of oppression is so ingrained that people naturally do those kinds of things. So in Jennings, we have an in-school suspension in every school. And so you would go there. When students come out of jail, there really is no, or juvenile, there's no, they come right back to high school. There's really nothing in between, no counseling. And so we have what we call a JEPITS program, where they go there first. You have mental health counseling. You can stay there for a year. Some kids like to stay there, and then they transition back to their school. I mean, giving the support and the resources. Unfortunately, again, the mindset piece for our teachers, for our leaders, that has to change. And that's just, to me, that piece is huge. And when you start talking about what needs to change. For us, like you, Brittany, when our teachers, the very first day, they go on a home visit on their training. I mean, that's part of what they do. But for our leaders, we give them dismantling racism training. I will just tell you what that, dismantling racism for every school principal, it should almost be required. Schools should have social justice training in college. I mean, none of that occurs. So if you don't do it as a superintendent or as a leader, it just won't happen.
Well, could I add too that, you know, when you were talking about what you've done in Jennings, and you mentioned that you have mental health and other health care programs, I think that is really key. Because a lot of teachers, you know, I agree completely that race is a big part of that. In some communities, it's also economic disparities. You know, they've been poor, they'll always be poor, and they're behaving poorly, so, you know, we don't want them. We know that. People carry those prejudices with them. But I also think it is fair to say that a lot of our kids are coming to school with heavy challenges. You know, poverty is toxic. Family disruption is toxic. Violence in the neighborhood is toxic. A lot of little kids have developed all kinds of anxiety and depression and all sorts of problems that are not being tended to. So you have provided your teachers, I mean, in addition to the training and, you know, the accountability that you want to invest in them, you've also provided them with an alternative. So if they see that child acting up, acting out, unable to sit down, unable to behave, rather than seeing it as a behavior problem, see it as a health problem, see it as an environmental problem. Because I'll tell you, one of the other problems, and maybe you don't have it so much in St. Louis, but it's still a big problem on the East Coast, is lead paint poisoning. And you know, we have so many kids who are so affected by the time they're in third grade. Their IQ has been dramatically reduced because they have, you know, lead in their brains. And so this has to be looked at, as you've looked at it, in a very broad way. And you've got to provide alternatives. And the numbers, Pastor, that you just gave, the disparity is, you know, truly a wake-up call. There will be kids of all races who the best of intentions, the best training of teachers, they will have a problem with. But the vast majority of kids need something besides being thrown out of school or being referred to the juvenile justice system.